This exclusive from The Guardian indicates that 7 in 10 people believe that charges for the NHS are on their way. Let's have a look at this in more detail, guys. Let's go. Good morning, good afternoon, good evening, guys, wherever you are in the world. This is REGANELITE here with an exclusive from The Guardian. And the headline is 7 in 10 people believe charges for the NHS care are on their way. The poll finds large majority in the UK think key principles of the health service will be dropped in the next decade. So we know that that unfortunately, because of the state that the National Healthcare Service is in, a lot of it is under privatisation, and in the end, unfortunately, a lot of it's going to end up coming out of our own pockets rather than the tax that we pay, the national insurance, is it? My apologies. It's going to be coming out of it, and that we pay in to get the free healthcare that we have, and it's clear that we are going down that direction. Our children and our children, as this stands, are going to be paying for their treatments, for their doctor's appointments, for their cancer, for all kinds of things, in order to stay alive, to live a healthy life, which is outrageous, really. We were once had the best healthcare service in the world, and we're now at a point where we still have I would still be fair to say that we still have one of the best healthcare services in the world, but it's going to be coming out of our own pockets now in the case, rather than us having to walk in. And in a time where we're already struggling to make ends meet, this is not good for any of us. So 7 in 10 people in the UK believe and charges for the NHS care will creep in over the next decade, ending the health service's record of being free at the point of use, a polling has found. One of the NHS key founding principles from 1948 is in peril. 71% of the public believe, according to a survey carried out for the Health Foundation ahead of its service's 75th birthday this week. Despite almost 3 in 4 people saying the NHS in its current free form is crucial, 51% said they expect to pay for some services within the next decade, while 13% think most services will need to be paid for upfront, and 70% anticipate charges for all services. My fear is the 7%. We're going down that road, guys. I fear that, and it's it's not just. I don't think it's just the Conservatives. I think the last Labour government should have done more to make sure that the NHS is protected as well. It's easy to paint all politicians the same, but I do think Labour our last Labour government, have some bare responsibility to blame on this, to make sure that any and everything should have been done to make sure that the Conservatives don't do this. Tim Gardner, an assistant director at policy at the Health Foundation, said the think tank interpreted the findings as an expression of concern at what the public values the most about the NHS. Affordability, care provided free at the point of use may be under threat. He said the durability of the principle that the health service would provide care based on need and not ability to pay has been regularly questioned throughout its history, especially at times when the service is under great pressure. There has been growing calls for radical changes such as charging for GP appointments and A&E visits, added Gardner. Politicians such as Rishi Sunak, the Prime Minister, Liz Truss, his predecessor in Number 10, and the former Chancellor and Health Secretary Sajid Javid have all backed one or both of these ideas as potential ways of raising money for the NHS and reduce demand. Critics dismissed them as zombie ideas that were impractical and would not help. The Health Foundation survey of 2,540 over 16s conducted by Ipsos was carried out at a time of huge pressure on the NHS, owing to the backlog of waiting lists and staff shortages, and as junior doctors and consultants strike gloom this month. On Sunday, Amanda Pritchard, the Chief Executive of the NHS England, urged the government and health unions to settle their dispute as soon as possible, saying patients would pay the price for the unprecedented scale of the action. And she said strikes would not become business as usual for the NHS. Yeah, it's that the Conservatives' solution is privatise, put it all in the hands of private companies and let them deal with it and look at it as a cash cow. Your life for a pound, pretty much. That's what they are looking at. They're looking at as potential cash cow. Anything they can look at as potential cash cow. That's kind of where they wanted to go with it, and it's quite a real shame, to say the least. While there is a current standoff, the British Medical Association, the BMA, wrote to Sunak on Sunday asking the government to enter mediate talks to break the deadlock on junior doctor strikes to reach a settlement. Steve Barclay, the Health Secretary, had on Sunday accused junior doctors of suddenly walking out of talks. Yeah, they're not changing their position. They don't want to pay them the fair pay they need. But Professor Philip Banfield, the new chair of the BMA Council, will give a speech on Monday saying it is the government that is refusing to go to ACES or acknowledge that devastation on the NHS has been wrought by successive UK governments. Separate polling from Ipsos shows that most Britons support healthcare workers in the way of strikes, overpaying conditions this year despite the worsening disruption. Backing for junior doctors at about 56% in June. With 5 days of junior doctor strike following 2 days of consultant strike scheduled in the middle of the month, data shows industrial action has already led to more than 648,000 cancelled appointments, procedures and operations, expatiating backlogs. This is a number of things. It's not just the strikes, obviously. It's the austerity that has taken place from 2010 onwards, guys, that has led to this. And it's pretty brutal, to say the least, that people should be entitled to healthcare regardless of who you are, wherever you are in the world. And yes, everything needs to be paid, but we're talking about being able to live a decent life. And people are suffering all because of money. That's pretty much what it all is about at the end of the day, isn't it? Money, 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 and not the human side of it. West Street and the Shadow Health Secretary said there is no doubt that having run down the NHS for over 13 years, many Conservatives will now use their failure to argue that the founding principles must be abandoned by making the cases for charging. He said Labour would never let this happen. I don't buy that for a second, especially with Keir Starmer in Murdoch's pocket. The future of the NHS will be on the ballot at the next general election, he said. It was Labour who created the NHS to make sure that they was there for us when we needed it, deliver the shortest waiting times and the highest patient satisfaction in history. It will fall to the next Labour government to rescue the NHS from the biggest crisis in history and breathe new life into the service so it is still there for us in the next 75 years. Daisy Cooper, the Deputy Liberal Democrat leader and party health spokesman, said the Lib Dems would set out plans to ensure that we have an NHS fit for the 21st century that remains free to the point of use before the next election. Waiting lists, staff sick days and social care demands are all soaring and only getting worse under this out-of-touch Conservative government, she said. Tory peer James Bethell, who was Health Minister at the height of the COVID pandemic, said the situation with waiting lists was already so bad that it consultated rationing, but said she did not think charging for services was a good idea. He said that people might think the pressures on the NHS making charging inevitable. That doesn't mean it's either a good idea or it's popular. I haven't seen any evidence of that charging will improve the outcomes. He argued for a new contract between the government and the public that is not just a one-way promise for free access but more of a partnership around healthy living. That requires leadership from government to create an environment where ordinary people can make realistic, healthy choices and are supposed to fight diseases, he said. Instead, too many of us are consistently battling against junk food, mouldy homes, dirty air, toxic workplaces and addicted algorithms that drive us to porn, casino and depression, and losing the battle with huge costs to healthcare, benefits and productivity. Yeah, all that stuff is all that stuff, guys. All that stuff destroys us. If you have a healthy life, you're not relying. If you have a healthy life, if you have income is good, if you have a good job, if you have not a good home, and you've got, you're happy with generally content with your life, you're not going to be relying too much on your healthcare because if you look after yourself, you're not going to be reliant on it. But when you factor in what's been happening over the last 13 years with the homes, the toxic, as all these things are that are causing them depression, casino, porn addiction, not being able to pay your bills, the mental health side of it, all these things are playing a factor into it. This is absolutely 100% true. If you don't, you've got to deal. It's not just a case of just fixing the NHS. You need to fix society. You need to give people a reason to be healthy, to stay away from these kind of things. People have to live within a means that they can be able to be happy in, and we don't have that in the UK right now. To be honest, it feels like a long time since some people felt that. With the NHS struggling, the Health Foundation survey shows people appear to have little faith in politicians promising to keep the NHS free, even though they would overwhelmingly like to see the cover model continue. According to the survey, the NHS ranks highest as people's first choice when asked about what makes them proud to be British compared with the democracy, culture and history. Now 54% of those surveyed. Data also revealed the public are pessimistic about the NHS ability to make key future challenges, with 70% believing that the NHS is not ready for the increase in health demands of an ageing population. As of right now, no, it's not. Not in my opinion anyway. It found some degree of split along political lines, with 66% of people intending to vote Conservative more likely to expect user charges from some services compared to 51% of Labour voters. See, if you want the NHS free, why would you vote Conservative, is what my question to you would be. A senior Tory source said, the NHS is the most treasured national institution. We are fully committed to its founding principles of healthcare for all free at the point of delivery. As we celebrate its 75th anniversary of the week, we have backed the NHS's long-term workforce plan with an extra $2.4 billion of investment to cut waiting lists and put the services on securing footing long into the future. For the NHS to carry on caring for us for the next 75 years and beyond, we need a strong economy, and the biggest threat to that is a Labour plan for a $28 billion annual spending splurge fueled by uncontrolled borrowing. About 80% of those surveyed think the NHS needs an increase in funding, compared with 70% who thinks it should operate within its current budget, with some degree of support from the dedicated NHS tax, an increase to national insurance, or an increase to income tax. I think an increase to in national insurance would be better rather than charging people. Obviously nobody wants to pay more tax, but I think if you need to increase national insurance in order to help fix the NHS, then do it. It's in my opinion. The NHS in England is due to receive only a 1.2% increase in its budget this year, a third of its historical average of 3.6%, despite long waiting times, growing patient dissatisfaction, and increasing alarm that it's broken and unable to provide the urgent care quickly. Yeah, guys, I think this is a really scary time for a national healthcare service. It is pretty much on the ballot box at the next general election, whenever that may be. There's no question about it. It's so sad to see how far it's fallen so quickly. But I just feel that we're going to be going down that road of bit of paying for it. And I don't mean through taxes. I just think we're going to end up just paying out of our own pocket at a time when we can't afford to make ends meet as it is, guys. It's very hard to take. I mean, I'd like to think that Labour won't charge, but I mean, I want to believe West Streeting when he says that it will be free, but I'm having trouble believing that, guys. But what do you guys think? Let me know down in the comments below. Like, share and subscribe as always, guys. Thank you very much for watching, and I will catch you all very, very soon.